You've probably heard the term for a long time, but what is little leaguer's shoulder and how do we treat it and prevent it? I'm Dr. David, orthopedic surgeon, sports medicine specialist, and author of That's Gotta Hurt, The Injuries That Changed Sports Forever. I provide education, information, and commentary on all sorts of sports and exercise, injuries, injury treatments, and injury prevention for athletes and active people so that you can stay healthy and perform your best. One of the most common problems in youth sports is overuse injuries. And nothing really shows that, no injury shows that better than little leaguer's shoulder. This is a problem, as you might expect, of the shoulder related to usually pitching, baseball pitching, but too much overhead activity without enough time to rest. So it's the baseball pitcher that pitches, 3-4 times a week, certainly way more pitches per week than they should do, maybe way more pitches in a month or over the course of a year, but it's this repetitive stress without enough time to rest. It's not just baseball. In theory, it can be any overhead sport. So tennis and swimming, throwing a football as a football quarterback, javelin throwing. There's lots of examples. Volleyball even could do it. Baseball is the one most commonly associated with it. And it's an overuse injury. And it's typically an injury where the growth plate at the top of the shoulder absorbs that stress, and you can see it on x-ray sometimes where that growth plate starts to widen. And fortunately, it almost never needs surgery. It's going to heal on its own. The problem is the treatment is almost always a period of rest from throwing or whatever the physical activity is, which is usually not what the young athlete and his or her parents really want to hear, but that typically does get it better. It may be 3 weeks, it may be 6 weeks, but it almost always, in fact, I can't say I've ever done a surgery for it. It does heal on its own. Take some time, not just shutting somebody down from that activity, but maybe doing a little bit of work with a physical therapist to strengthen the muscles around the shoulder, but almost always gets better without surgery. The key is to prevent it from happening in the first place. So following all the recommendations we talk about, follow the pitch count rules and the inning count rules that your association has. Don't start throwing off-speed pitches like curveballs or breaking balls before you're done growing. Don't pitch for the same team, or I'm sorry, not the same team. Don't pitch for multiple teams in the same season, and don't pitch through pain. I think all of those are good rules of thumb to minimize the chance of developing little leaguer's shoulder. Okay, has your son or daughter ever suffered little leaguer's shoulder, and how was it diagnosed? What symptoms was he having, and what did the doctor tell you that he needed to do? I'd love to hear your experience, and I bet viewers all around the world would love to hear it as well. So below this video, please share your experience. How did it go? How did it get better? We'd all love to learn from your experience. If you like videos like this and you want more information on sports and exercise, injuries and injury treatments and injury prevention, subscribe to my YouTube channel. I record a couple of these videos every single week and they'll get delivered directly to you. So click the subscribe button in the upper right corner of the page. I hope this video was helpful, so thank you so much for watching, and I look forward to seeing you right here next time.